Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham. We're Team Needham discussing everything healthcare. I'm your host, Shawn Needham, along with my producer, Lindsay, and my beautiful wife will be joining us here shortly. So today we want to welcome back Dr. Carmen Kavali. She is a board-certified plastic surgeon from Atlanta, Georgia. And this is, the third or fourth or fifth part in a series of plastic surgery. And you don't want to miss this one because this is a very, very popular topic. A lot of people have questions about it, me, myself included. And we're going to be talking about liposuction. And I know it sounds like, to somebody that's a lay person like myself that, how complicated can liposuction be? Could we really dedicate a half hour to liposuction? Dr. Kavali guaranteed me that we talk a lot more than a half hour on liposuction. So she's an expert in this field, and this is what she talks about all day long. So you don't want to miss this episode. So Dr. Kavali, with that, welcome back to our show.
Thank you. Thanks for having me. I'm excited to talk about liposuction, and we can indeed fill much more than a half hour with this seemingly mundane topic.
Right. I mean, it seems really simple on the outside. You make a little incision. I'm assuming things before I even interview you, but I mean, this is my perception. So I'm guessing there's a lot of people's perception like this is that, you make a little incision, you take a tube and you kind of suck the fat out. So explain why it's a lot more complicated than that.
Well, you have the basics down for sure. In fact, those are the fundamental steps to liposuction. And I want to emphasize that liposuction is indeed surgery. When you make a little incision, even if it's a tiny poke hole, and put something under the skin to do a job, that is surgery. So if somebody's calling it, minimally invasive magic or whatever the latest marketing terms are, they're just trying to gloss over the fact that this is actually a surgical procedure being done. The purpose of liposuction is to remove fat, and we can do that from any subcutaneous fat that exists, and that means fat that's under the skin and on top of a muscle. So we can do that for a neck, for arms, for bra rolls, for a chest, even for breasts, actually, for abdomens, anywhere there's fat that's under the skin and above a muscle, we can use liposuction to contour it safely. Now, toes and calves are a little more tough. Yes, people ask
toes.
For toes. People have asked for toes. I politely decline, but there is fat there. If you use a small enough cannula, you can make it happen. Calves are very tricky, but let me kind of backtrack here. So anywhere there's fat under the skin and above a muscle, we can treat with liposuction. And the reason I make that statement repetitively is because people sometimes expect us to be able to remove fat that we can't access safely. For instance, intra-abdominal fat, that visceral fat, that omental fat, that fat apron that's under the muscles of the abdomen that creates that rounded kind of beer belly look, that tight fat, that we cannot safely access with any surgery, really, for aesthetic purposes. So liposuction addresses fat that's under the skin and on top of a muscle, wherever in the body that might be. It is for contouring. It is not for weight loss, and we'll come back to that too. But the basics of any liposuction procedure are that first you have to be numb, and then you have tiny incisions made. I call them poke holes. They're tiny incisions that are about 3 millimeters in length, and then a cannula is used, which is a long, hollow metal piece that has some array of holes along its length or just at the tip, depending on how the cannula is designed and what the surgeon's preference is. And then the cannula is put under the skin through those little incisions within that fatty layer to contour the fat by removing it. When it's removed, it is permanently removed. The fat cells are permanently removed, but you can never safely remove all of the fat in any given area. You have to leave, for aesthetic reasons, a thin layer behind so that the skin is not sitting right on that muscle. That's a kind of fake tethered, that's a bad liposuction look. If you've ever seen somebody look cobblestoned or lumpy and bumpy after liposuction, that's someone who's had areas that have been over resected or under resected adjacent to one another. there wasn't an even contour produced from that procedure. So you don't want the skin stuck on the muscle. You want a little layer of fat left behind. So for that reason, we say the results are permanent, provided you maintain your weight. Those fat cells left behind have infinite capacity to expand, even though your body's not going to make new fat cells as an adult. The ones that are left behind have infinite capacity to expand. So if you maintain your weight, you maintain your results. If you gain your weight, you're going to see the fat enlarge first in areas that were not treated with liposuction, because there are relatively more fat cells in those non-liposuctioned areas. But if you continue to gain weight, those fewer fat cells in the treated area will eventually get bigger enough that you notice them too. So that leads to the myth of people saying, well, I had liposuction and the fat went somewhere else. It did not go anywhere else. That means the weight wasn't maintained, and you saw it first in the areas that still had relatively more fat cells than the treated area. So that's a good start for you. What questions do you have?
Janet? I've got some, but Janet, go ahead.
Well, I guess so. Really, your ideal candidate is going to be somebody who's already maintained some weight loss prior to coming in for liposuction. Is that correct?
Absolutely. That is absolutely true. Liposuction, and this is another myth. One myth is people think the fat goes somewhere else after they have it suctioned out, and that's not true. The other myth is a lot of people believe liposuction is for weight loss. It is not, and you may not see much change on the scale. If you've ever seen on, any of the YouTube videos where they show a pound of fat versus a pound of muscle, a pound of muscle is much more compact and small. A pound of fat is bigger. So if I remove a pound of fat, we don't even measure it that way. We measure it in cc's or in volume, not by mass. But if I remove what is the equivalent of a pound of fat, you're going to look like you lost 15 or 20 pounds, but you're not going to see any change on the scale more than a pound.
Interesting. So what about, you mentioned, let's back up on calves. Why are calves difficult to remove fat from?
They're very difficult because there are several muscles in the calf, and the fat is usually tight on top of the muscle, and the skin doesn't have a lot of forgiveness to it. So it's very easy to create a waviness or a contour deformity along the calf. You need multiple access points, multiple tiny little incisions, and very small cannulas, not a large 4 millimeter or 5 millimeter cannula. You need to use like 2 millimeter cannulas to get those contoured. So it takes a little longer, it takes a little more finesse and a lot more skill to get those tight areas correct.
So you mentioned you declined on liposuctioning somebody's toes. Have you ever liposuctioned calves? Because they are difficult.
I do liposuction calves. I do. It has to be the right candidate. And the key is, are their calves large because they have muscle hypertrophy, or are they large because there's fat? If there's fat, then they're a good candidate for treatment. If they just have large muscles, then that requires just re-education to explain that that's not something we can treat surgically.
Right. So, Janet, do you have more questions for Dr. Kavali?
Well, I guess one of the things that I would feel for a candidate would be to be realistic, right? I mean, so what is your approach with your client prior to going through with this type of procedure?
Realism is that is a key for anybody undergoing any plastic surgery procedure. We have to have realistic expectations set from the get-go, from the very start, or they're not a good surgical candidate. If someone comes in expecting liposuction to allow them to buy a whole new wardrobe, that probably isn't true. If they expect it to be for weight loss, that definitely isn't true. If they expect that they're going to see skin changes, tightening of the skin after liposuction, that is also not true. Liposuction results depend greatly on your underlying contour and your skin quality. If you have very poor skin quality from, say, weight changes or from prior pregnancies, if you have stretch marks, that's a sign of poor skin quality. And that just is what it is. It's not a criticism. We all have stretch marks. 85% of women have stretch marks. So it's just a reality. It means that that dermis, the deep layer of the skin, is scarred and there's no elasticity left in that portion of the skin. So if we do liposuction under skin that is stretch marked, that skin is not suddenly going to become flat and smooth and tight. It's just going to be smaller. So whatever you sit down and can pinch, after liposuction, that pinch thickness will be much smaller, but all of that loose skin is still going to be there unchanged. And so that's a discussion I have a lot, especially with women who come in and say, I don't really want a tummy tuck, I just want liposuction. For some women, that ends up being the right surgery, but only if they have extremely realistic expectations about what liposuction can and cannot accomplish. That leads to another thought about liposuction. A lot of marketing is out there, starting way back when with smart lipo, laser-assisted liposuction. And then all the copycats came along. It was slim lipo and air sculpt, and I can't even remember all the names of them. The bottom line is liposuction is liposuction is liposuction. And if you add laser heat using any of those other modalities, and I have used them in the past myself, if you add laser heat, the marketing tells you, oh, it's to tighten the skin. In reality, what it does is it creates scar tissue, which can tether the skin and make it seem a little smoother, but it's scar tissue and it's not soft. It doesn't treat the stretch marks. If you have a large swath of loose skin, there is no amount of laser liposuction that will address that adequately. And I know this because I've done tummy tucks on some of my patients who I've previously done laser-assisted liposuction on. And what did I find? A whole bunch of scar tissue inside. No better skin quality, just stuck scar. And that's actually when I stopped using the laser-assisted liposuction, when I realized it wasn't actually giving any skin tightening. It was just creating scar and some tethering. But it's a great marketing ploy. And if people believe that it gives them skin tightening or lifting, then it's a difficult thing to dissuade them of. But the reality is it doesn't do that.
Well, thanks for educating us on that, because I'm sure there's a lot of confusion when it comes to some of those marketing ploys like that. And as you kind of said, liposuction is liposuction is liposuction. It's really, from that standpoint, it's the simple thing of sucking fat out of the body. So, any of those other modalities still are, kind of marketing ploys. Is that what you're saying?
That is true. Yes. And some of the marketing of the laser-assisted liposuction devices initially would advertise that you don't have to do the suction part. If you just heat up and melt the fat and dissolve it and explode the fat cells and destroy them, you can just leave it. I want to talk more about those contour deformities that can happen with liposuction. There are some newer techniques. They don't require fancy equipment. They don't require any, $150,000 laser device. The laser that's why the laser companies are promoting these things, because they want the physicians to spend a whole lot of money promising patients better results that aren't really backed up by the data. But there are techniques that surgeons can use to give better results with liposuction. So way back when, the liposuction cannulas didn't do anything except sit there. And so all the function was based on the surgeon's arm moving the cannula back and forth. That's hard on the arm, and it's much harder to get a smooth result. It's easy to fall into tracks that have already been kind of broken down. So the path is already made, and so it's easier to make contour deformities doing that manual traditional liposuction. I use micro-air power-assisted liposuction. There are other brands as well. There's nothing special about the brand, but what it means is the cannula vibrates. I forgot what the numbers are. It's like 1,000 times a minute or something. It's you can feel it in your hand. You can feel it in the cannula. but it helps it to break through fibrous tissue. It helps it to break through any previous scar tissue, and it helps to create multiple channels for harvesting the fat without falling into a single channel over and over again. It does not create more trauma for the patient. It does not create more bruising. It does not create more swelling. It creates a smoother contour and is easier on the surgeon's shoulder and elbow. The other thing that can be done to create a smoother result is something called safe liposuction. It's separation and fat equalization. That's the acronym, SAFE, separation and fat equalization. When the numbing fluid is put in to numb the patient, so I do this awake in the office, or I do this asleep in the hospital or the surgery center. It just depends on what we're doing, whether we're combining with other surgeries. So either way, though, you still get that numbing fluid under the skin because it contains epinephrine, which makes the blood vessels smaller and creates less blood loss during surgery. Way back when liposuction was first developed, they didn't know this. They didn't realize how much blood loss you could have from liposuction. So epinephrine was not part of the wetting fluid. They did it dry way back when, 1960s to start with, and patients had a lot of problems with blood loss. So then the fluid was added, and then more epinephrine was added, and lidocaine for numbing was added, and suddenly we have a safe way to do awake liposuction. So when the wetting fluid is put in, or that tumescent fluid is put in, I can use that same power-assisted vibrating cannula to inject the fluid under the skin. So now I'm starting out when I'm injecting the fluid by breaking up the fat already. And some of the fat is dropping into little puddles and some of it is hanging tough. But then I follow it with the cannula, also vibrating, but I'm not injecting fluid now. I'm suctioning out the fat. Well, some of it's already loose, and then some of it I'm continuing to break up and remove. And then at the end, I come back not on suction, turn off the suction. So now I just have the vibrating cannula. So now it's just a tool that's moving things around. It's not removing fat anymore, but I go back through the area that I've just treated. So any bits of fat that are uneven are going to get dislodged, and they're just going to fall into any little crevices that are left behind. So that's the separation and fat equalization. I didn't come up with this. It's something that Simeon Wall, a plastic surgeon in Shreveport, Louisiana, actually developed some time ago and has talked about it at a lot of conferences, but I've adopted that technique and it really, truly does help. It also helps, oh, there you go, EVL. It also helps when if someone comes who's had liposuction done somewhere else and they have contour deformities or irregularities that are bothering them. You can use that infiltration, that vibrating infiltration, and then just the cannula on vibration with no suction to correct those prior contour deformities. You're not removing more fat. You're just dropping that fat from the full areas into the not so full areas after you've broken up the scar tissue. So there are ways to correct liposuction gone wrong, and there are ways to get it right to start with.
Yeah, I would assume patients would really like you to get it right the first time. And that's why it's important to go to a qualified plastic surgeon that's board certified like yourself, correct?
That is correct. I will add that for liposuction, many dermatologists are also very adequately trained in liposuction. In fact, the dermatology community is the one who first came up with tumescent anesthesia, which is liposuction done under straight local anesthesia with no other medications at all. It's a higher ratio of fluid than I typically use, but it was initially developed by a dermatologist way back when.
And speaking of dermatologists, I actually know a dermatologist that used to do liposuction, and one of the reasons he quit, which is kind of why you're talking about this, is it was a very laborious procedure. And he got tired. He just got tired. I mean, physically tired from doing it. And his dermatology practice was going very well. So he quit doing liposuction. I'm assuming it's before some of this fancier equipment that you were talking about came out, is what I'm assuming. But,
well, even with the power-assisted liposuction, I have bilateral labral tears in my shoulders, MRI proven, and it's from liposuction.
Wow.
Yeah.
So yeah,
it's very intense. It's very It's very physical work.
Right.
It's not violent. I guess you see some YouTube videos where they sort of make it look violent. It's not violent at all. It's very controlled, but it's constant repetitive motion for hours at a time. And it's just wearing. Yeah. So even with the power assisted.
So what patient would benefit from going under general anesthesia, and what patient would benefit from just local? How do you make that decision?
That's a great question with multiple considerations. First is, are you an anxious patient? Are you super scared about knowing what's happening? Well, then we're going to the OR where you can have anesthesia and be unaware. Even if you're under just twilight sedation, I don't do that in my office. I don't have an accredited surgery center in my office, so I don't do that type of surgery. If I do it in my office, you're going to be awake. You're going to be awake and chit-chatting with me. We're going to check your vitals, of course, but you're not on continuous monitoring because we're not giving the types of medications that would require that. That's how we do it safely. So if you're really scared and you just don't want to know, then we're going to the surgery center. That's on the patient. That's the patient's choice. So from my consideration, if we're doing more than 3 or 4 liters of liposuction, I prefer to be in the OR for that. So we can do some fluid replacement, check vitals continuously. The other and major consideration is, how much numbing fluid do I need to do the procedure safely? And that's not related to how much fat I'm taking out. That's related to what surface area I need to numb. For instance, if somebody wants their abdomen, I know I can do that in the office. If they want their abdomen and their back, well, I might not be able to do that in the office in one setting because the numbing involves lidocaine. And as a pharmacist, there is a maximum safe dose of lidocaine that one can give at a single time and be safe before we have heart problems, before we have neurology problems. So that for liposuction is 35 to 55 milligrams per kilogram. And that's much higher than the 5 to 7 milligrams per kilogram that you're probably used to seeing as a pharmacist as the toxic numbers. The reason for that is it's dilute, it's in the subcutaneous plane, it's not IV, and a lot of it is removed with the liposuction procedure. So 35 to 55 milligrams per kilogram is the maximum safe amount of lidocaine in a single setting. But for adequate numbing, on average, for an abdomen, I might need 2 liters of fluid. And that means 2,000 milligrams total of lidocaine. And for the average person, that's pretty close to their maximum.
Right.
Right.
Yeah. So if I need more than 3, I can cheat up to 55 milligrams per kilogram and use 3 bags. But if I need more than that to get adequate numbing, then we have to go to the OR to do that. Or we have to split it up into 2 or 3 surgical sessions. And who wants to do that?
Right.
Get it done at one time, one recovery, be done.
Right.
Yeah.
So we're going to stay tuned because we're going to share some pictures later on that you can comment on. In the meantime, what's this cool sculpting stuff? Tell me about it.
So cool sculpting is not liposuction, but it is a way to remove fat. It is also permanent. Now the company won't say permanent because, FDA, but just like liposuction, the fat that is destroyed by freezing is permanently destroyed. Those fat cells aren't going to replace themselves. So cool sculpting is cryolipolysis. It is not surgical at all. There is no scar. There's no nothing. It's a hand piece that sits on the fat surface that you want to treat. It involves suction. It pulls it up into these 2 cooling panels, and those panels get cold enough that the fat freezes. Literally, ice crystals form in the fat cell wall, and that destroys the fat. Now, why doesn't it harm the skin or the muscle or the nerves or the bones or the blood vessels? Because all of those tissues are damaged at a much lower temperature. So you have to freeze even more to damage any of them. So we protect the skin with, there's a little cloth and gel, and then put the cooling panels on for 35 minutes. And you leave with a little, cold stick of butter, basically, once it's all done. Get that massaged out in the office before you go. In 1 month, you'll start to see results. And in 3 to 4 months, you have your final results. Cool sculpting is great for smaller focal areas. You're probably not going to come in and do your whole abdomen and your whole back with cool sculpting because the price would be astronomical compared to liposuction. Because there's a fixed asset cost related to each cycle that's used for cool sculpting. So for instance, it might take 8 of those cycles to cover an abdomen, and then it might take another 4 to cover a back. So 12 cycles is going to cost you a lot more than 1 session of liposuction would cost. And what you can expect from cool sculpting is 20 to 25% fat reduction in the treated area with each treatment session. So if you're smaller, you can get away with 1 treatment session. If you're a little thicker and you need more fat reduction, then you do a second session a month later to further reduce, and then you just go on about your way. So it's nice that there's no downtime. It's nice that it's not surgical. It does work. It is very effective. The people who complain that it doesn't work have typically undertreated. If it's recommended that you have 6 cycles and that you repeat 4 of them in a month in particular areas, and you say, oh, I'm only going to do 3, you're not going to see results and you're going to think it didn't work. So it's best to, pick a focal problem area and treat that, or just do liposuction.
That's really good to know. I know a plastic surgeon that does both, and he kind of is like on the fence like you. Of course, he's a plastic surgeon, and he, for a lot of patients, mostly it's probably best to go with liposuction.
Yeah. And I do both as well. I have two cool sculpting devices in my practice. I definitely believe in the technology. I've had it for years. It works. It brings patients in who just like liposuction. A lot of patients will come in and say, I want cool sculpting, and they turn into liposuction patients. Liposuction patients come in and say, I want liposuction, and they turn into tummy tucks or mommy makeovers, because when you've got a practice with a full toolbox, we're not just going to sell you the hammer that we have, Right. Everyone doesn't have to be a nail. We can literally treat everybody appropriately who comes in the door because we've got all of the options available.
That's awesome. So let's go into some pictures. Do you mind? Or Janet, you have a question?
Nope, go ahead.
Let's start with that male patient, Lindsay.
So it's interesting. Men are very commonly liposuction patients. My men come for Botox because they're in sales and they can't look angry anymore. They come for liposuction because they just have this stubborn area, usually on the belly, that won't go away. And they come for eyelids, upper eyelid surgeries, to just not look so heavy and tired all the time. Those are the 3 main things men come for.
Interesting.
Yeah.
I would have never guessed the eyelid thing.
Yeah.
I guess I need to start looking in the mirror a little closer.
So this gentleman, he had liposuction of his abdomen and waist, and it looks like I also fixed a hernia on him, a little umbilical hernia. You see, he had an outie, and then he's got an innie at the end.
Oh yeah. It's funny. I got to give you a compliment, because you must look at people all the time and you look at them different, whether it be their face, whether it be their bellies and they're in a bikini, and you can see stuff like that. I would have never even looked at them. Oh yeah, sure.
It was the first thing I saw was, I fixed his belly button too.
Right. Well, this is obviously, I'll let you keep commenting, but this is obviously a very compelling before and after for liposuction. So tell us about the treatment. Was it just one treatment? Tell us all about that.
So this was one treatment. Because I fixed the hernia at the same time, this is someone that I did in the surgery center. He is someone, if he didn't have the hernia, that I would have done liposuction in the office if he had wanted to. So he would have been a very appropriate candidate. He chose not to treat his chest at the same time, but he would have been a good candidate for that as well. The male chest does well with liposuction for that little bit of gynecomastia. But he's a good candidate for liposuction of his abdomen because that roundedness, when I pinched it, was all outside. It was not visceral fat. It was pinchable fat on top of the muscle and under the skin. So I told him, this is something I can definitely treat. The next question from men is always, well, you're going to show me my six pack? And my answer is always, if it's under there,
right.
Yes. If you don't have one, I'm not making one for you. You go work on that yourself, and I'll give you the best advantage to show it off when you get it. He also had good skin tone, so he's got nice retraction of the skin there. Men have that advantage because they don't have babies, of course.
So what percentage of your practice is male versus female?
About 15%. My practice fits the national statistics pretty much perfectly. Across the board for plastic surgery, 85% of the patients are women, 15% are men. And
that's regardless of if the plastic surgeon is a male or female?
It is, although there are some plastic surgeons who are specifically catering to the male population. So within their practice, they have a lot more men. Right. But across the board, the average is 85 and 15.
Good to know.
So this is a woman who, I love this picture because look at her belly button. It didn't change. In fact, she might have a deeper fold after the surgery above that belly button, because she is someone who I had a discussion with and said, listen, if you want flat and tight and smooth, we need to do a tummy tuck because look at your skin. And she says, yes, I know that, but I think I want more babies. So I don't want that right now. I just want you to give me the best result you can give me without doing a tummy tuck. Let's just do liposuction. Oh yeah, and we did a breast lift. So she loves her new perky breast. She didn't want anything fuller than what she had. So there were no implants there. It's just a breast lift with her own tissue. And then a lot of liposuction on that lower abdomen and the upper abdomen and the waist. You can see that little back and bra roll. She still looks a little swollen to me. This might be a 6-week follow-up picture because that upper back bra roll looks a little full to me, and it looks a little brawny, like it's got some swelling in it. So this is going to improve between this time point and her 6-month follow-up. But this is a very realistic expectation that somebody can anticipate if they have loose skin, if they have stretched skin, and they opt for only liposuction. This is a good representation of that because her belly button does not look any different. In fact, some people might say it looks worse because there's more of a crease and a hangover of skin after the surgery.
Yeah, that's definitely a good sales pitch for liposuction. I mean, I would have never guessed that with liposuction you could get that dramatic of a change.
Yes, it's removing thickness. If you can pinch it, that's what you can get rid of with liposuction. And as long as it's outside the muscle and under the skin, that's what we can address.
So would you recommend when that gal had the surgery before she had babies? So you would, basically what you're saying is, would you not recommend a tummy tuck if you're not done having kids?
It depends. If you think you might want another baby at some point in a distant nebulous future, and you're really unhappy with where you are at the moment, you can absolutely have a tummy tuck and successfully have a baby later and not completely undo everything we've just done. For this woman, though, she had a timeline. She says, in the next year, I'm going to have another baby or I'm not. But I know it's going to happen or not in the next year. And I said, well, if you're that concrete about it, let's not do the tummy tuck and risk messing things up. Again, they don't go back to where they were before, but you definitely do loosen the results some if you have a pregnancy after a tummy tuck. I've had a handful of patients who've had oops babies after their tummy tucks.
And what's the recovery time? You mentioned that one gal there, she might have still had some swelling and stuff after her liposuction. You mentioned a 6-month follow-up. So how long until the body is as long as your weight stays stable, how long until the body kind of remodels and after liposuction?
Great question. You see most of your results within 4 to 6 weeks. But there are tiny, gradual, grass-growing kind of changes that continue to happen up to a year after the surgery. What I tell people how to personally gauge it. If you are still healing and that scar tissue is still substantially remodeling, you are going to be super sensitive to sodium intake, to salt. So if you go eat chips and salsa 6 weeks after your liposuction, the next day you might look completely bloated in all of the areas that I've done liposuction. It's very sensitive to salt intake. So what I tell people is You're done when you have your chips and salsa and the next day you still feel okay and there's no substantial change. And for the majority of people, that's sometime between 9 and 12 months after the surgery.
Oh, so up to a year. That's good to know. Yeah.
So this woman in this picture you're showing had a tummy tuck. 100% had a tummy tuck. This is not a full liposuction result. Many of my liposuction patients are not just having liposuction, though. I may even say the majority of them are having combination surgeries. They're having a tummy tuck and liposuction, or they're having breast surgery and liposuction, or a thigh lift and liposuction. So it's very much a procedure that complements other procedures well. In this woman, the change on the front of her abdomen is all tummy tuck, 100% tummy tuck. The waist, that is 100% liposuction. That is not from the tummy tuck. That's contouring with liposuction through the incision that I use for the tummy tuck. So there are no extra scars. So we do the liposuction to contour that waist a little bit over the hips. I also contoured her thighs. If you look at the thigh gap before and after, it's substantially different. It's much wider after, the space between her knees. These photos are standardized. She's standing on an octagon with her feet on either side of the octagon, and it has numbers on it. So her feet are touching that octagon in both the before and after. So her feet are in exactly the same position. It's very standardized. It's not cheating by having her stand further apart for the after.
Hey, that's good. Thanks for clearing that up. I would imagine there's people that have cheated, and obviously for before and afters. So thanks for clearing that up and being totally transparent.
Yeah, there's a lot of deception out there, and there's just no reason to be if you're doing good work, and a lot of it. Just put it out there. So the waist, the thighs, that's all liposuction. That flat tummy, that's a tummy tuck. So these are the sorts of pictures, the one before and the one now, that I show people and say, if you want that flat and tight and smooth result, you're going to need a tummy tuck. If this is the right time, go ahead and do that. If it's not, then we can still do liposuction, but let's be realistic about what you can get.
So one thing that you've been hitting on at least 2 or 3 times is that liposuction is about contouring. Is that correct?
Absolutely.
Yeah. And tummy tucks necessarily are not, correct?
Tummy tucks are not necessarily just for contouring. Now, they're not for weight loss either. Yeah. So in that regard, it's similar to liposuction. Neither one is for weight loss. But a tummy tuck, I would say, gives more dramatic contouring because it addresses 3 things: the skin, the muscle stretch, and the extra fat. Liposuction only addresses the extra fat.
That makes sense. So as we wrap this show up, Dr. Kavali, what would you like our listeners and viewers to know about liposuction?
I think the main takeaway, and I don't even know that I've hit on it necessarily, is that liposuction is liposuction is liposuction. There is no magic type of liposuction that is going to work better than another. It truly matters who's holding the cannula. That's what it boils down to. And you want someone that can show you a lot of before and after pictures of their personal work, a lot of personal testimonials, if those make you feel more comfortable. But don't go for the fancy new brand of liposuction, because if the person doing it isn't an expert at liposuction, you're not going to get great results.
Makes sense. So Dr. Kavali, we're going to go ahead and tell us how to get a hold of you if people have questions, and we're going to go ahead and stream your website here. Dr. Kavali, how could people get a hold of you if they have more questions?
They can call the office at 404-250-3333, or they can always shoot an email to info@drkavali.com. That's info @drkavali.com.
Well, thank you so much for educating our viewers today, and stay tuned in a few weeks because we are going to put all this together, and Dr. Kavali is going to tell us and show us what a mommy makeover looks like. So we're going to put all these episodes together to get the final picture. So Dr. Kavali, thank you so much for being on, and Tune in tomorrow morning on our midweek podcast. I'm traveling early this week, so it won't be on our regular Thursday. It'll be Tuesday. We're going to have Ethnie Nance back on our podcast. She is going to be talking about how hospitals are profiting from COVID. You might not be surprised, or you may be surprised about that, but you do not want to miss out. She's an expert in that field, and don't miss out. Tomorrow at 8 a.m., we'll be streaming from the Moses Lake Professional Pharmacy Studio again. Dr. Kavali, thank you so much for being on.
Thank you. It was great. 30 minutes on liposuction.
That's right. Thank you so much.
Thank you. Have a good one.
You too.